To understand what epilepsy is, we need to understand how the brain works. The brain, that organ in the head, is the result of the union of 86 billion neurons communicating with each other by electrical frequencies from the static electricity of our body. When our brain gives order for our arm to move, it is firing a boost low-intensity electric until you reach the arm. This electrical impulse travels through neurons and passes through the brain region responsible by the motor control of the body so that it reaches the muscles of the arm. All this happens when we decide to move the arm. Imagine now a group of neurons that resolves to fire these same impulses without ours consciousness and falls to the ground, can bite the tongue or cheek part. Arms and legs struggle quickly and in a rhythmic way like a puppet, lasting of a few seconds. And this can be once a month, once a year, every day. Convulsion can happen at any age, both people who have epilepsy and people. Authorization at high intensity, causing a shock to the brain and arteries on the brain, which is responsible for controlling the body. And when firing causes what we know it brace. We know it as a seizure, causing all the muscles to thaw. The air passes in a forced way by the vocal cords and causes a scream-like sound. The person loses. Who does not have epilepsy may have the seizure. Medicine describes the seizure as a crisis provoked. That is, a blow to the head may have a seizure. Alcohol abuse may have a seizure. Fever may have a seizure. Epilepsy is the name that represents a group of unprovoked crises, which happen spontaneously, of various forms and degrees, by means of feelings such as anxiousness, tiredness, stress, nervousness, by flashing light, diesel smell, prolonged reading, and deprivation from sono. As the crisis is part of the epilepsy crisis group, it is called the epileptic crisis. Medicine, proper eating, and healthy habits maintain electrical frequencies from the neuron at normal frequency, thus avoiding crises. Do not exclude the possibility of the person having epilepsy. If the patient does not remember the crises, the person who witnesses it becomes a witness useful in investigating the type of epilepsy in question and consequently in the search by a suitable treatment. Sometimes it is necessary to experiment with more than one medicine to get the desired effect. And then it gives the neurologist for the electroencephalogram examination, which is the examination that measures the electrical frequency of neurons to see if these frequencies are within the normal parameters and thus avoid crises. Examinations such as electroencephalogram and neuroimaging are tools that assist in the diagnosis. The patient's clinical history, however, is very important, as normal tests or even combine more than one medication to control the widespread crisis, e.g., which is the most dramatic type of crisis from the epilepsy crisis group, known as convulsion. However, if on one hand, more than one medication or even combining more than one medication achieves the desired effect to prevent seizures, on the other hand, the patient loses any trace of quality of life, because it is hard for the patient, as several chemical components are used to synthesize a medication, and each of these components has a side effect on the patient. Research shows that CBD or cannabidiol extracted from marijuana, besides controlling the generalized seizure and others from the epilepsy group, with a single drop does not have as much side effects compared to other medications, which improves the quality of life and self-esteem of the patient. A diet rich in lipids and calories, the ketogenic diet, has been used especially in children, but it must be very closely monitored by the doctor and closely followed. The metabolism created by the careful preparation of this diet can increase the seizure threshold in some patients. Surgery becomes a solution when medication fails and when only a part of the brain is affected so that it can be removed safely without causing harm to personality or other functions. Alongside medical treatment, technology has beneficial effects. There are apps that record seizures and pass on this information to the attending doctor of the patient. The doctor with this information can either increase or decrease the medication dosage. There is also the vagus nerve stimulator, a kind of pacemaker with a lead wire connected to the vagus nerve, but the cost is still high, around 200,000 reais, and only the wrist nerve alerts its user or caregiver that a seizure is about to occur, allowing the person to sit down if standing or be tracked through GPS on the smartphone. It costs around 1,000 reais. The person with epilepsy in traffic, we must remember that driving is a privilege and not available through private means. It maintains the electrical frequency of neurons at the normal frequency, thus avoiding seizures. There is also the Embrace bracelet, which besides being a watch, also serves for physical activity, as it monitors heart rate, aiming to detect a seizure before it even happens through the 3 sensors on its back, which in contact with a right. And in order to obtain this privilege, it is necessary for the person to be fit, both physically and mentally. According to statistics, the frequency of traffic accidents involving people with epilepsy differs little from the general population. The number is exactly the same as the number of accidents in the general population. The number is much higher with alcoholics. Alcohol consumption represents 1,000 times more the cause of accidents than epileptic seizures. There are recommendations that should be made to an individual with epilepsy who wants to drive, such as being seizure-free for at least a year and under medical supervision to drive. Only vehicles in Category B, that is passenger cars, not be a professional driver, people with epilepsy than in other employees, and productivity rates are equal or higher among people with epilepsy. We can help the patient with epilepsy to adapt professionally, first, by indicating the most suitable profession, second, by facilitating their job search, third, by not the attending physician should reinforce the natural progression of sick leave, but encourage, that is, not drive heavy vehicles in public transportation, even free of crises for years. People with epilepsy and employment. Several studies show that 50%, 60% of people with epilepsy hide their condition of being epileptic or seeking employment. Research reveal that absences due to illness and work accidents are no more frequent in the patient to continue working, thus helping them reintegrate into society. Guidance and education of employers is the first step towards accepting employees with epilepsy. The main concern of companies is profitability, thus avoiding problems with employees' health. Unemployment and underemployment are very common among people with epilepsy, resulting from the resistance of employers to hire them. Prejudice is one of the main factors that support this procedure, as epilepsy in most cases does not incapacitate individuals for work. The person with epilepsy should be referred to the INSS to obtain benefits of sick leave only when their seizures are uncontrolled, to the point of hindering their professional activities. Employers are reluctant to hire people with epilepsy due to fear of legal or insurance issues if the employee gets hurt during a seizure, and because of prejudice and concern that an employee with epilepsy may negatively impact the image of their company. A person like this might be missing out on hiring a Van Gogh, Dostoevsky, or even a Machado de Assis for their company. That's why many people with epilepsy prefer not to disclose their condition to potential employers in health issue. Educating employers about epilepsy to eliminate misconceptions may be the answer to underemployment and unemployment among people with epilepsy. Companies should collaborate for inclusion. The focus should be redirected to the person and not to epilepsy. Assessing individual capacity and not the diagnosis. One must have goodwill and tolerance towards the other's limits. Encourage the person to believe in themselves. Think that the person with epilepsy has heard their whole life that they are incapable. Another important point is to guide the work team towards accepting that person. In the work environment, epilepsy can be seen as an opportunity for personal development of the person with epilepsy, which can result in skills to be utilized in the market of work. A person with epilepsy fights against epilepsy every day. Nowadays, companies look for people who know how to face the unexpected events that occur in the company, a quality called resilience. I see this quality present in a person with epilepsy, because having epilepsy is being in control in the face of the unpredictability of the crisis all the time. The choice of employment. The diagnosis of epilepsy or occurrence of seizures are not reasons to disqualify a person for a job. In cases where restrictions are necessary for certain types of jobs, decisions should be based on individual evaluations of the person and not on a generic diagnosis of epilepsy. As the most suitable profession, we refer to the type of work in which the person feels adapted and without risk to life. Professions involving the danger of falls, working with machines or cutting objects, and proximity to fire or electricity should be avoided. Partially on the type and frequency of seizures. If epilepsy is poorly controlled, it can destabilize the family and reduce their financial and emotional reserves. In these cases, the family as a whole needs support from a professional in the field. Epilepsy can disrupt the family consensus of autonomy and competence, so that family balance, epilepsy, and the family. Epilepsy, like any medical or chronic problem, affects not only the person suffering from epilepsy, but also their family. Siblings of a child with epilepsy may be deprived of their parents' attention due to the extra care for the child with epilepsy. The impact of epilepsy on a family depends. The word epilepsy is not used neither inside nor outside their family circle. The child cannot openly discuss their condition and soon begins to see it as something negative. Parents generally react to the diagnosis of epilepsy with a mix of apprehension, shame, anxiety, frustration, and hopelessness, contributing to the child seeing their condition. Can be recovered. It is important that its members reach a consensus on what epilepsy is and how it can be managed. In a study conducted with relatives of children with epilepsy, it was observed that some parents feel ashamed to have a child with epilepsy. This becomes a problem only for the child and not for the family as a whole. As stigmatizing, overprotection should also be avoided, as it leads to behavioral and personality changes, making the child socially isolated. Skill's social relationships are not learned, and she remains insecure, dependent, emotionally immature, becomes socially maladjusted, not because of epilepsy itself, but because of excessive parental overprotection. The World Health Organization aims to develop the highest possible level of health for all peoples. In 1997, a global campaign was created to reduce the impact of epilepsy stigma, as well as to improve the diagnosis and management of patients. The global campaign Epilepsy Out of the Shadows, Epilepsy, involving psychological support from the state and social support from the company. However, the reality is different in Brazil. Starting with associations that provide excellent psychological work for people with epilepsy and educate their families on how to deal with people with epilepsy in their meetings. Many of these associations are built, affects the quality of life of its bearer, causing them to live in the shadows. Many isolate themselves at home because they do not know when or where a seizure will occur and lead an isolated life. After the meeting at the WHO, it was established that all nations should provide psychosocial support to people with epilepsy. Psychosocial support means, with private money, extra money from family members who do not find public support and come together to build these associations. On the other hand, the employer, who only cares about the profit of their company and does not fulfill the main role of their company in society, which is social inclusion, and does not hire a person with epilepsy for fear of loss, for fear of labor or insurance problems, even if they are qualified for a suitable profession or have passed a public exam. The state needs to provide psychosocial support to the person with about epilepsy as soon as it is diagnosed. Not only medications, because it is a public health issue and health is a right for all and a duty of the state, it needs to work together with companies and generate jobs for those affected. Employers need to play the main role of their company in society, which is social inclusion. Appropriate work is the most important factor in the quality of life of people with epilepsy, for their personal growth and within society. Thanks to the work of associations, it is effectively bringing epilepsy out of the shadows in our country. Purpleday, the Day of Purple, is the day of awareness about epilepsy. It is a global campaign to bring epilepsy out of the shadows, created to reduce the impact of the epilepsy stigma, as well as demand psychosocial treatment from the state. Purple Day was created on March 26, 2008 by the Canadian Casey Megan at the age of 9, motivated by the difficulties and prejudices faced as a person with epilepsy. The initiative, supported by the Epilepsy Association of Nova Scotia in Canada, is represented by the color purple, which was chosen as the symbol of epilepsy, inspired by the color of the purple lavender flower, as it represents the sadness, loneliness, and isolation that many people affected by epilepsy experience. The campaign's goal is to spread correct information and thus break the taboo of the past that persists to this day among uninformed people, and to end the prejudice that greatly affects those with epilepsy, and to show that these individuals should not feel alone, regardless of the country or place they are in, every day. On March 26th, a purple light is projected on monuments or historic buildings in all countries in support of the campaign. On this day, people wear the Purple Day t-shirt and distribute leaflets with information about epilepsy to all people, even the astronaut, American Rick Arnold, dressed in purple, straight from the International Space Station. On the 10th anniversary of Purple Day, in support of the campaign, Brazilian legislation established the obligation for companies with 100 or more employees to fill a portion of their positions with people with disabilities. This legal quota of positions is also known as the Law of Social Inclusion, or Quota Law. Article 93 of Law 8213 of 91, in the case of companies with more than 100 employees that fail to comply with this requirement, the labor inspector, by complaint or inspection, may fine the company and issue an infraction notice with the consequent imposition of an administrative fine. For the law, the special need called disability is considered when there is a loss or abnormality of structure or of their psychological or physiological function. The Parliamentary Front in Defense of the Rights of People with Epilepsy demand that they recognize that epilepsy causes limitations in the workplace, just like a disability, and include epilepsy in the quota law so that people with epilepsy can benefit from the law, which obliges employers to hire them, as a seizure is a shock that starts in the brain, causing more limitations than a physical disability, in my opinion, when it manifests as it affects the 3 stages of health. And health is a complete physical, social, and mental well-being of the human being, unlike a physical disability. An example is Stephen Hawking, who had his body paralyzed by amyotrophic lateral sclerosis, but a brilliant mind, so much so that he was an internationally recognized theoretical physicist and cosmologist for his contribution to science. In addition to hiring, the company must adapt its physical space to accommodate people with disabilities, and there must also be awareness among employees about the importance of inclusion and the company's social responsibility. Companies also benefit from complying with the law and grow in social inclusion in such a way as to contribute to reducing unemployment among people with disabilities, and the company gains social credibility. The intention of fines is to encourage entrepreneurs to comply with regulations, especially of epilepsy, as grounds for receiving sickness benefits, in some cases disability pension, and to include epilepsy in the quota law. Companies with 100 or more employees. The amounts of the fines are significant and impact the company's revenue. The Parliamentary Front in Defense of the Rights of People with Epilepsy in Brasilia, which represents all associations in the country, aims to demand rights for the bearer of epilepsy, including psychosocial support from the state and recognition by Social Security.